But let's find out officially. I'm joined now by Dr. Miguel Nacher. He's a consultant neurologist at Zahra Hospital in Dubai. Dr. Miguel, thank you so much for joining us. Yeah, we're seeing these headlines about rising ADHD diagnoses globally, but actually this new research says that the actual rate hasn't changed. What's your take on that in the UAE context?
Well, I think it's a very good question. Thanks a lot, first of all, for making it. I think that we have to be very careful because ADHD is a neurodevelopmental disorder that has a marked genetic component. So there has been in the last time possibly the idea that more patients are having ADHD, but in the reality is that we are detecting more frequently in the school. So then we also have to be aware that inattention is not always ADHD. Many patients will have inattention because they will have a stress and sleep disorder, and mood disorder, and other reasons to be inattentive, and that will not be ADHD. So you have to be very careful when diagnosing an adult with ADHD, because in the majority of the patients it will not be. ADHD is a neurodevelopmental disorder that normally begins in the childhood and has to disrupt the education. So I agree that probably more patients are having ADHD now. We are detecting it earlier, but possibly we are also overdiagnosing it.
Are you seeing more people coming forward for assessment here in the UAE, both in adult life and also bringing their children in?
Yeah. So many patients and families bring kids, but we also see many adults now considering I might have ADHD. And if they have developed a professional career, probably they do not have.
Is it easy to get assessed here?
Yeah, but ADHD should be assessed clinically and with scores. Then it has to be conducted a clinical interview to see what has been the evolution along time and the consequences. The neuroimaging is also good to be done, but normally it's a clinical diagnosis. And it requires a very comprehensive assessment with scores.
Do you think it's conceivable that the pendulum has swung too far in the opposite direction now, and that people are being diagnosed or at least self-diagnosing with ADHD when they perhaps don't have it?
Yeah, this is a very common phenomenon that we are seeing. There is a very extensive debate on late onset attention deficit and hyperactivity disorder, but overall, there is a lot of overdiagnosis now. And we have to be very careful with that because overdiagnosing ADHD leads clinicians to put patients on chronic treatments with amphetamines. And this has consequence. So it's a serious material, what we are talking about now.
Yeah, I mean, do you think that the public and the private health systems here are equipped to deal with the rising demand? Now, I ask that because I have heard stories of drug shortages or people finding it very hard to get the medicines that they need.
Oh, you are pointing to a very, this is completely correct. Normally, institutions here will have capacity to appropriately diagnose the disease, but then medications for ADHD are highly controlled medications in the country, and very frequently in Dubai there is shortage of medications. Medications appear and disappear randomly, not only the brands, but also the doses, Concerta, Ritalin, and the different presentations that it has. They appear and disappear from the country, and patients with the condition struggle a lot to acquire the medications in the pharmacies of Dubai.
Is medication always required? Do you think that maybe there's an over-reliance on it in this situation?
Medication is required to protect the educational and professional performance. If the patient has already been successful in life in achieving education and a professional position, medication is not always needed. Normally, these patients will need a high dose of medications when they are between 15 years old And when they finish the university, they begin to need very low doses of medications or none.
Well, I mean, it's such an interesting topic. I mean, unfortunately, I've only got about a minute left with you. I could do this for ages. So overall, we're really lucky in the UAE. We know we're really lucky. You know, if you need to see a doctor, you can get one at you can see somebody at the drop of a hat. You know, it's the same if you need to go to ER. I imagine it's the same if you need to see a doctor about ADHD, a psychiatrist. Do you think that people here in the UAE who have ADHD are adequately supported?
Yeah, I think so. There are very nice institutions that support appropriately patients. So I think here they have access to the technologies, physicians, and normally to the medications that they need. I think they are appropriately supported.
Really lovely to have you join us on the line, sir. Thank you so much. Eid Mubarak. We really appreciate your time over this public holiday, in particular, Dr. Miguel Nacher, consultant neurologist at the Zahra Hospital, Dubai, giving us his analysis and expertise on this Eid weekend. And as you can imagine, this is one of those topics where I'd love to hear from you. Were you recently diagnosed with ADHD? Do you suspect your child might have it? Get in touch. Find us on social media at Dubai 1038 FM, or you can find me at georgia.tolly. Make sure you tag us with your views.